Hi, and welcome to today's segment of Our Ventura TV. My name is George Alger, and today's topic is Oncology Esthetics. And our guest expert is Lonnie Williams, who is introduced as complementary cancer treatment to Ventura County. Welcome, Lonnie.
Thank you.
So let's talk, first of all, about a little bit about what you do before we get right into Oncology Esthetics.
Okay. Well, I've been a registered nurse since 1994, and I'm also a licensed esthetician with a specialty certification in oncology aesthetics.
Good. Now, what does that mean, esthetician?
An esthetician is someone who is a skincare expert that works with clients to improve the health of their skin. Also can take it another level. It does maybe waxing and makeup as well. And so basically work on the skin itself to improve the health and beauty.
Good. So now let's break down this topic here of oncology aesthetics. What does that mean?
Okay, well, oncology is the science of working with someone who has cancer, the treatment or surgical intervention of cancer. Aesthetics is the art and science of beauty. So together it's cancer and beauty, which one wouldn't think they go together, but they actually do.
Good. So now, how do they go together?
Well, when someone is diagnosed with cancer, the effects are far-reaching. There's major shifts in their physical health and their psychological health, financial health, emotional health, and the impact of surgery or chemotherapy or radiation therapy has significant effects with their skin. So how oncology aesthetics may benefit an individual going through cancer treatment is varied. First and foremost, imagine, you've gone your whole life, you have a full head of hair, you have your eyebrows, you have your eyelashes, your skin seems to be, normal or average health and is basically the same color. And once surgery or chemotherapy or radiation therapy is introduced, one may lose all or some of their hair, they may lose some or all of their eyebrows or eyelashes, and the reflection in the mirror has completely been altered, and that has some significant impact on someone's self-esteem and image. And they don't feel well, they don't look well, and major depression can set in. And where oncology aesthetics can benefit an individual is someone who's trained in that can guide that person through choosing, say for instance, skincare products that are safe and effective to treat whatever imbalances they may be having as a result of side effects of the treatment that they're receiving, camouflage techniques with certain makeup, recreating the look of eyebrows and eyelashes, consulting on maybe the proper type of wig or head coverings, also hand and foot treatments to help soothe the skin problems that they may experience in that area. So that's just on the external side. Someone that's going through cancer treatment has significant emotional concerns. They may be the primary breadwinner of their household and now they're unable to work. The family member that's caring for them is often needing of respite as well. So this person's going through surgery, they've been poked, they have blood draws, they're getting infused. In general, there's a lot of fear. And when they can go to someone that can help them with all of those things, the whole person gets treated. It's not just necessarily externally, but a place for them to escape the fact they have cancer for an hour. There's a lot of healing that goes on. In order for someone to heal, they need to have hope and they need to feel that their needs are being met in many, many areas, and that's where someone in oncology aesthetics can really benefit.
Wow, so that does embrace a lot of different ways to help a person. Yeah. How long has oncology aesthetics been associated as a complementary treatment to cancer patients?
Well, oncology aesthetics was first introduced by someone named Morag Curran with an organization called Touch for Cancer, and that began around 2007. So it's still relatively, a newer concept, and it's growing. More and more spa professionals are getting educated and trained and certified to provide this service to cancer patients.
Okay, so I didn't realize it was that new. Does this mean that many of the doctors who are actually caring for patients might not even be aware of it yet?
Indeed. So Obviously, the reason I'm here today is to try and just put that message out that there's help for cancer patients that may be experiencing skin and hair and nail related issues in regards to their treatment, and that they have maybe an option to find out if there's something they can do to look good and feel better.
Good. So is for contemporary treatment of cancer, is this area generally just not addressed at all?
It is addressed, but I think there's some limited information with regards to how it can be addressed. Really critically important is ingredient safety. Using the right type of products that have safe and effective ingredients to help cancer patients that are non-toxic, that are not carcinogenic, that aren't going to add to their problems. They may have been using personal care products for years that they were doing fine with, but the body's chemistry changes when you alter the skin cells, when you introduce chemotherapy, even with radiation therapy. And so using the right type of product that may be approved by Oncology Esthetics. So there's certain lines that have been actually approved by Oncology Esthetics that are safe and effective for cancer patients. Yeah.
Good. Now, for someone who may have cancer, be going through cancer treatments, and they're just looking for some guidance in this area, are there some tips that you might be able to convey to the viewers?
Yes. Actually, I will mention that the American Cancer Society has a free program. It's called a Look Good, Feel Better program. It's been around for 25 years, and they do offer classes to women. They're free of charge. They're about 2 hours long, and they do give some simple guidelines as far as cleansing and moisturizing, and maybe some simple makeup tips, and maybe some tips for their hair. But beyond that, they need maybe further care after that. They don't provide that, but it's a great introduction to learn more about how they can help take care of themselves. I'm a good resource for providing outside resources if they need other care tips, like unfortunately many women who've had mastectomies and have reconstruction surgery, they've had their nipple removed and then they no longer have one, and so there's specialty tattoo artists that can recreate the areola. I mean, that's really important. You think about it. This is a woman who's had some serious self-image changes to their body, and so there's definitely people out there that can help recreate it as much of a normal outside to help heal the inside as well.
Good.
Yeah.
Now, in speaking with plenty of people generally about health, I've heard from a number of guests the importance of having organic food. Does this have a place in Oncology Esthetics?
It does. The focus with Oncology Esthetics is more of a holistic plane. Again, we're not treating cancer. This is a complementary therapy to help patients who are undergoing cancer treatment or about to go under cancer treatment, or even are survivors of cancer treatment, cope with the physical and emotional changes that occur. And looking at ingredients, not only externally but internally, are very important. And so, yes, organic, and I'm a proponent of organic and vegan and gluten-free type of diet because it does promote wellness. And your skin is your largest organ, and it is a reflection. It will reflect on the outside what's going on in the inside. And so, very important to be well nourished and take care of yourself internally. It'll be reflected externally. So it's all encompassed one together.
Good. Now, you mentioned something that I thought was intriguing. Vegan. So is being a vegetarian or a vegan beneficial to Oncology Esthetics?
I would say that there are definitely some advantages to including more vegetables in the diet. I'm not going to say someone needs to be a strict vegan in order to recover fully from cancer, but there are definitely some studies that have indicated eating a more botanical diet have really shifted their recovery in the positive way. So personally, I would always defer to having someone meet with a nutritionist or someone who, if they're interested in learning more about holistic healing or homeopathic healing, to get guidance in that. A lot of people have dietary sensitivities and allergies that they're not aware of that impact their healing, and so all those things need to be addressed.
Good. Now, is this discipline? Is this complementary treatment something that you actually do need to work hand in hand with the doctors, or it can be done independently without close coordination?
Oh. Well, let's just say that having open communication is critical in order to help an individual with any kind of health challenge. So understanding a patient's lab values is really important. So in meeting with a cancer patient that would like to get some help with some skin-related issues, it's very important to know, when they've had surgery, or if they've had surgery, what type of, if they're on chemotherapy, what type of chemotherapy they're on, when was the last time they had their treatment, seeing lab values. So yes, working with a doctor is very important, because there's certain times during a cancer treatment that it's not safe to have a treatment, and there's other times when it's be the most beneficial. So really understanding what's going on with that person medically, it's really very important, especially understanding if they've had lymph node removal along with any kind of surgery, because there's massage techniques that cannot be used in certain individuals in certain areas where you can cause harm. So really having a very good knowledge of the human body, the physiology, anatomy is very important. So yes, talking with the doctor and making sure they know what's going on as well is critical. So yeah, it's a joint effort.
Okay, so we're just about out of time here, Lonnie. Wonder if you could give us a website where viewers might be able to go for more information, and if you have a summating message for the viewers.
Well, if people would like to get some more information on how Oncology Aesthetics might be able to help them or a loved one that's going through cancer, I can be found at Skin Solutions by Lonnie. That's my website, www.skinsolutionsbylonnie.com. And I can provide additional education and resources, consultation to see if Oncology Aesthetics would be beneficial for them. My final statement is that how to help someone who has cancer and know that they're not alone, and that there is support and help for them if they're having, adverse side effects from radiation or chemotherapy or having had cancer surgery, and that they can look good and feel better.
Great. Thank you very much, Lonnie.
Thank you, George.
This is George Alger signing off for this segment of Our Ventura TV. Until we meet again.